Measles outbreak. Surges to nearly 500 cases. Is your state next? Intro. A disease we thought was gone is back and spreading fast. Measles, one of the most contagious viruses in the world, is making a terrifying comeback. Nearly 500 cases have been reported across 19 states, with Texas at the center of the outbreak, recording over 400 cases in just the last few weeks. What's even more alarming? Almost all of these cases are in unvaccinated individuals or people with unknown vaccination status. As the virus spreads, some parents are turning to vitamin A as a supposed treatment, leading to dangerous cases of vitamin A toxicity in hospitalized children. But experts warn there is no substitute for vaccination. So how did we get here? Why is measles back? And what can you do to protect yourself and your family? Let's break it all down. Where is measles spreading? The 19 states affected. Measles isn't just a Texas problem, it's a national crisis. The CDC has confirmed cases in at least 19 states. 1. Alaska. 2. California. 3. Florida. 4. Georgia. 5. Kansas. 6. Kentucky. 7. Maryland. 8. Michigan. 9. Minnesota. 10. New Jersey. 11. New Mexico. 12. New York. 13. Ohio. 14. Pennsylvania. 15. Rhode Island. 16. Tennessee. 17. Texas. 18. Vermont. 19. Washington, Texas remains the hardest-hit state, with over 400 cases, and the numbers keep climbing. In just 3 days, 73 new infections were reported. At least 41 people have been hospitalized, and many more are at risk. This outbreak is likely even worse than reported because there are delays in state reporting to the CDC. If you live in one of these states, you could be exposed without even knowing it. Why is measles spreading? The dangerous drop in vaccinations. Measles should be a disease of the past, but low vaccination rates are bringing it back. The numbers are shocking. 1. In 2013, 7.5% of kindergartners in Gaines County, Texas, had vaccine exemptions. 2. By 2023, that number skyrocketed to 17.5%, one of the highest rates in Texas. The result? A perfect storm for an outbreak. According to the CDC, 1. 97% of cases are in unvaccinated people or those with unknown vaccination status. 2. Only 1% of cases are in people with just one MMR dose. 3. Only 2% are in fully vaccinated individuals, 2 doses. Measles spreads like wildfire in communities with low vaccine coverage. The fewer people vaccinated, the easier the virus spreads, and the more severe the outbreak becomes. What's really happening in Texas? The rise of measles in children in Texas is ground zero for this outbreak, and children are the most affected. Who is getting sick? 1. 164 cases in children ages 5 to 17. 2. 131 cases in children under 4 years old. 3. A growing number of cases in infants too young to be vaccinated. Why Texas? Texas has some of the highest vaccine exemption rates in the country, especially in rural areas and private school communities. When fewer children are vaccinated, measles finds a way in and spreads rapidly. Hospitalizations are increasing, with dozens of children being treated at Covenant Children's Hospital in Lubbock, Texas. And the complications aren't just from measles. Some kids are showing signs of vitamin A toxicity. The vitamin A controversy. Is it a cure or a risk? With the outbreak growing, some vaccine skeptics, including HHS Secretary Robert F. Kennedy Jr., have promoted vitamin A as a treatment for measles. But here's the truth. 1. Vitamin A does not prevent measles. 2. Vitamin A does not cure measles. 3. Overdosing on vitamin A can cause serious health problems. The World Health Organization, WHO, does recommend vitamin A as a supportive treatment to help with measles-related complications, like blindness and eye damage. But in Texas, parents are giving their unvaccinated children high doses of vitamin A without medical supervision. The result? Some kids are showing signs of vitamin A toxicity, including 1. Abnormal liver function. 2. Kidney damage. 3. Severe complications that could require hospitalization. Bottom line, there is no substitute for the MMR vaccine. The MMR vaccine, your best protection against measles. The measles, mumps, and rubella, MMR vaccine, is the only proven way to prevent measles. How effective is the vaccine? 1. One dose, 93% effective. 2. Two doses, 97% effective. When should kids get vaccinated? 1. First dose, 12 to 15 months old. 2. Second dose, 4 to 6 years old. Most adults who were vaccinated as children do not need a booster. Before the vaccine existed, the U.S. had 3 to 4 million measles cases per year, leading to 1. 400 to 500 deaths annually. 2. 50,000 plus hospitalizations. 3. Thousands of cases of brain damage and blindness. Now, thanks to vaccines, measles was almost eradicated, until misinformation and vaccine refusal brought it back. Measles was nearly eliminated. Don't let it spread again. This outbreak is a wake-up call. Measles is highly contagious, dangerous, and preventable, but only if people get vaccinated. The facts are clear. Measles is back because vaccination rates have dropped. Most cases are in unvaccinated individuals. Vitamin A is not a cure or a substitute for the MMR vaccine. If you or your children aren't vaccinated, now is the time. What do you think? 1. Should schools require full vaccination for attendance? 2. Should vaccine exemptions be more restricted? 3. Do you think misinformation is making this outbreak worse? Drop your thoughts in the comments. Like and subscribe for more health updates. Share this to spread awareness. Your family and friends need to know. Measles belongs in history books, not in our hospitals. Let's stop this outbreak before it gets even worse.